On an uncomfortably regular basis, the world is threatened with potentially devastating epidemics. Measles, Ebola, H1N1, H5N1, SARS. In a world that is so mobile, health experts live in dread of the perfect microbial storm. Fortunately, we have someone who every day prepares for the battles we will inevitably face. She and her team unravel the secrets of the organisms that one day could wreak havoc. She is a Peter Wall Scholar at UBC who not only excels at science, but is an effective communicator about the importance of science education. Please welcome Jennifer Gardy.
Thank you, Sam. If they had told me this was a musical, maybe I would have prepared a dance number. But no, you are stuck with this. You are stuck with infectious diseases. So sorry about that. I'm going to tell you something you probably don't want to hear, coming from your friendly neighborhood infectious diseases control specialist. That would be me. I'm going to tell you this, that me and my colleagues up there on the hill at the BC Centre for Disease Control, we actually don't know a lot about how infectious diseases behave in the wild. It is okay to laugh uncomfortably, squirm in your seats at this point, because it's the truth. We are great at understanding how diseases behave in the lab. We are awesome at looking at things in a petri dish, but when it comes to understanding how diseases like Ebola, like measles behave when they get out there in you, but not you, because you are probably all very clean and hygienic. When they get out there in the other you that is elsewhere in the world, we don't know what they're doing. We are clueless. We are wandering around with a bag on our head, and that is a bag. That's not some sort of hazmat suit or anything fancy. It's just a bag. So we, as infectious disease professionals, we can't actually answer questions like, when there's an outbreak of a particular communicable disease, say tuberculosis, do all outbreaks behave in the same way? Are there common patterns to the transmission? Or is each one unique? Are they like special little outbreak snowflakes? We can't answer questions like, what makes the spread of a disease like Ebola in one community likely to lead to, tens or maybe hundreds of cases versus what we're seeing now in West Africa, where the spread in one community has led to tens of thousands of cases. These are questions that we don't have answers for, but that we need answers for. If we as public health are going to design effective public health prevention and control strategies, things to keep you safe, we need the answers to these questions. And that is really what my work is about. I am interested in understanding how diseases behave when they get into the community. How do outbreaks start and how do they spread? And to do this, I use a fairly interesting tool, a tool that is in me, a tool that is in you, a tool that is in every bacteria, every virus, every fungus, every parasite that causes infectious disease. A tool that is DNA. So DNA is the genetic material that makes up living organisms, and we call the complete set of genetic instructions to make an organism its genome. The genome is written in the DNA alphabet. It's 4 letters representing chemical bases A, C, G, and T. And using technology that we call whole genome sequencing, we can actually read the complete genomes of organisms like human beings. Our genome is about 3 billion letters long. That would be the equivalent of reading War and Peace approximately 932 times. I calculated, because I'm a scientist, we do things like that. Nobody wants to read War and Peace 932 times, but fortunately my job is easier because I'm interested in reading genomes from organisms like bacteria. Bacteria that causes tuberculosis, for example, its genome is 4.4 million letters. That's like reading War and Peace once. Still not enjoyable, but a lot more palatable than 932 times. I also work on organisms like measles, which has made the news recently thanks to Disneyland. And measles has a genome that's about 16,000 letters. I was trying to think of a good analogy to explain it, and then I realized that is approximately the same number of letters that an average teenager will text in the space of about 30 to 45 minutes in one vigorous texting session. We haven't discovered emojis in DNA yet. We may. If it is, it's probably the one with the poop and the little smiley googly eyes. But that's what I do. I read DNA for a living. And a few years ago, my group at CDC, as well as a couple of other groups around the world, particularly in the United Kingdom, realized something interesting, and that is that as a pathogen, as a disease-causing organism, as a germ, spreads throughout a population or a community, the path that it takes through that community will leave signals behind in its genome. It will leave little footprints written into the DNA. And we hypothesized that if we went in and read the whole genomes from all of the organisms that we took out of all of the patients in an outbreak of something like tuberculosis, we might be able to use these signals to figure out the exact patterns of transmission and figure out how that outbreak started and how it spread from person to person. This sounds complicated, but conceptually it is incredibly simple. It is so simple that anybody that has played this game, the telephone game, will understand. Telephone game, classic activity of elementary school teachers to keep their class busy for a little while so they can go to the bathroom or do something important. They will line all the children up in a line on the floor, and they will whisper a sentence to the first child in line, who whispers it to the next child in line, who whispers it to the next child, to the next child, to the next child. Then when the sentence reaches the end of the line, the kid at the end says what they heard. Then the teacher or the parent or whoever, whatever responsible adult happens to be present, says the sentence that they whispered into that first kid's ear. And then everybody laughs because the sentence is always different. What the teacher whispered into the first kid's ear is very different from what the last kid heard. In other words, the sentence has mutated as it is spread along the line of children. The exact same thing happens to a pathogen's genome as it spreads from person to person in an outbreak. It mutates. So what we do in our work when we're trying to reconstruct these outbreaks is analogous to if you did your experiment with the kids, did the sentence thing, and then said, okay, kids, go shuffle yourselves around the room into random locations. Then you went up to each kid individually and asked, what sentence did you hear? What sentence did you hear? What sentence did you hear? And from what they tell you, you try to reconstruct the order that the kids were sitting in. So an example would be if the sentence that was whispered into the first kid's ear was, the cat likes mice. By the time it reaches the last kid, it's turned into, the bat likes rice. You can ask the kids what they heard. Some will have heard cat. Some will have heard bat. Some will have heard mice. Some will have heard rice. You know that all the cat kids had to have been sitting in one part of the line. All the bat kids had to have been sitting in another part of the line. All the kids that heard rice, one group. All the kids that heard mice, another group. We can also take information about those children's social connections and use them to further our reconstruction and further figure out what order they were sat in. If we know things like Timmy will always sit next to Tommy, or Sarah will always sit next to Jane, we can include that information in our reconstruction and start to figure out the order they were sat in. That's exactly what we're doing, except instead of kids in a line whispering sentences to each other, it's people in a population spreading diseases to each other. Instead of asking them, yeah, it's grosser, but it's a good analogy. It hasn't failed me yet. Instead of asking them what sentence they heard, we're reading the whole genome sequences of the organisms, of the TB, of the Ebola, of the measles that we're pulling out of these individuals. So with that information combined with knowing what we do about, who shares a household with whom, who is in the same workplace, who ate the same food at this person as a restaurant, we can start to figure out how outbreaks happen. What is that telling us? One thing it tells us is how outbreaks in facilities unfold, hospitals, for example. It might help us to identify the source of a hospital outbreak, say of an antibiotic-resistant superbug. We can figure out whether it's a particular patient, a contaminated piece of equipment, something in, say, the hospital water supply. We can trace that infection, that outbreak, back to its source and fix that source. My own work is about how diseases spread in communities, diseases like tuberculosis, and I'm interested in finding out, are there common patterns to outbreaks? Do they all behave in the same way? And can we pick out in an outbreak who is liable to cause the most infections and target them for treatment and follow-up first? Doesn't just play out at the facility and the community level, though we can also look at this on a worldwide scale. So genome investigations have told us, for example, about how antibiotic-resistant gonorrhea, which is starting to become a huge problem here in North America, emerged from Japan, landed in Hawaii, worked its way up the west coast and subsequently eastward. So we, as Vancouver, know where to look to in terms of other cities for trends in future infectious diseases. So in the end, it's naive to assume that we can ever eradicate infectious diseases or even eliminate them, which are, even though they sound like the same thing, they're actually two completely separate concepts in the public health world because we love having multiple labels for everything. But, although we're not going to get rid of infectious diseases, we do have to live alongside them. And I think this new technology of DNA sequencing and genomic epidemiology, as we call it, which is really being pioneered here in British Columbia and here in Vancouver, is one of the things that gives us a fighting chance against these organisms. It gives us the ability to, for the first time ever, understand how disease is spreading in a population, and that's the information that we need if we are going to manage outbreaks of infectious disease and if we are going to prevent future outbreaks. So I will leave you with that and the admonition to just wash your hands. Wash your hands all the time. Go right now and wash. Just go wash, and thank you.